A little bit about Evara Health. We are an FQHC, federally qualified health center. We're located in Pinellas County, Florida, which is a peninsula with just under 1 million people. And we're actually the most densely populated county in the state of Florida. Last year, we saw over 61,000 individual patients in 16 different locations. I want to focus a little bit on the 29 grant funding sources and projects. Grant funding really provides a lot of the seed money that we need for many of our technology-oriented projects, such as our RPM implementation. 3 major grants we received really provided us with the funding to start the program and continue the program currently. A little bit about our patients. As an FQHC, we handle a slightly different population than your typical healthcare organization. 61% of our patients are racial or ethnic minorities. As you can see, 94% of our patients are below 200% of the federal poverty line, and 80% are below 100. 46% of our patients are on Medicaid or CHIP, and 25% of our patients have no insurance at all. As an FQHC, we never turn anyone away. We will provide access to anyone that needs medical care of any kind that we provide. A little bit about our approach. So when we started out on our RPM journey, we looked at how do we initially identify patients that might benefit from RPM services, patients that have transportation issues, chronic disease. Those are some of the areas we focused on initially. Patients with things like COPD, where just getting into a vehicle may be a lot for them. Hypertension, diabetes, stroke, CHF, and we're now expanding, as I mentioned, our services over to our prenatal and postpartum moms who might have gestational diabetes. Our goals really, as it says, is to be flexible. We want to make sure that we're providing this technology to every patient that could benefit from it.
The ultimate goal, again, is to get patients to manage their health conditions, get patients to take their medications, monitor their vitals and their blood flows, complete their follow-ups, like be more involved in their healthcare, because when they're more involved, we have better outcomes. Once we identify a patient, we are doing a really deep dive into their chart review. We are looking at everything before we reach out to engage them in the program. We're looking at their health conditions, their medications, do they have any recent hospitalizations? We're trying to identify any barriers to care, whether it's mobility, whether it's transportation, is it financial, is it a language barrier? We're trying to identify anything so that we can navigate that and get the patient exactly what they need. And the results speak for themselves, like it's working. Based on the patient feedback alone, we see improvements. Patients feel better that someone is watching out for them, and they're learning about how their lifestyle choices are going to affect their vitals.
We started out with enrolling patients primarily with multiple chronic conditions, generally diabetes, hypertension, maybe CHF. And then as we grew the program, we focused a little more and identified that just somebody who has diabetes has just as much of a need for the program as somebody who has multiple conditions. And so we continued to grow the program.
We took a lot longer to get our first cohort of patients than we thought it was going to take. So our initial plan was, patients who have 3 or more chronic conditions. And then, we did encounter some challenges getting patients to agree and to sign up and just generally be interested. So we had to adjust our goals. So we went all the way down to okay, we don't care how many chronic conditions they have. If they have one of these chronic conditions, if they need care, they are now a candidate for this program. So we pulled a list of our patients, we pulled our VBS team, and we improved our script for how we introduced the program. And that's where we started to see patients like, okay, I think I might be interested in signing up. Another challenge was probably communication. I think a lot of our providers, again, not knowing about the program. So make sure that you are communicating, make sure that you have routes and pipelines. And I think having a champion like Howard at the top of the program really made the biggest difference for us. And that just kind of leans into our recommendations for any program that you might begin related to RPM. Be flexible, communicate, make sure that you have really clear criteria for which patients are going to qualify or who's going to get the most benefit. People told us no at the beginning a lot, and that really helped us adjust our approach. Make sure that you have a distribution plan and a support plan. Who is going to help patients that aren't getting a tablet, patients who are going to be on the PC mobile, who's going to help them with their Bluetooth connections? We learned that really fast, that not all patients are really tech savvy. Some of them are, some of them aren't. We got a little bit of differences everywhere, but not all of our staff is very tech savvy either. So make sure that you have the right people in the right place, and then make sure that those people then have the support that they need to accomplish our goals.
Again, going back to health equity and being able to provide these services to patients, one of the benefits that we found in terms of when we were looking for an RPM partner, the kits that HRS provides give us a capability to provide this kind of technology to patients that might not have the tools to use some of the other services. So we've deployed both kits and mobile, but many of our patients don't have a smartphone. They may have a government flip phone, which can't provide some of those services. And so by having multiple ways of delivering RPM services to our patients, it allows us to provide that capability to patients of all different aspects, who may not have Wi-Fi at home, who may not have a smartphone at home, who may not have other tools that would allow them to access some of these technologies. The kits have really been a tremendous value to many of our patients who have said, I wouldn't be able to use this any other way